This is Brittany Wastel. I am taping my musculoskeletal assessment. To start the assessment, I would do hand hygiene and then I would do my general survey as we always do in our assessments. Moving forward, I would assess the shoulders, checking for symmetry. I'm going to palpate them, checking for any muscle atrophy, any deformity at all the way down into the joints, and in the back, checking for symmetry there, which they are. Then moving forward, I would go into range of motion. I'm going to have you move your arms up, and then back down the other way, and then actually go up again this way. Good. And then I'm going to have you adduct, I'm going to have you abduct, and then put your arms on your back, and then on the back of your head as well. Good. And then moving forward, I would go into the wrist. So I'm going to have you move there. Good. Then I want you to put your arms up, push against my hands, pull back against them. Good. I'm going to have you push out and push in. Good. Then I'm going to assess the radial pulse, which is nice, strong too. Brachial pulse, and then the epitrochlear nodes. Good. Then moving forward, I'm going to look at the lower extremities, looking at color, any peripheral vascular disease. I'm in the male looking for lack of hair, hair distribution, that type of thing. Then I'm going to palpate the dorsalis pedis, the posterior tibialis, which are both nice and strong, 2/2, and the popliteal. Then I'm going to test muscle strength, so I want you to push out on my arms. Good. And pull back. Good. And then testing range of motion in the knee, I'm going to do some passive. Good. And I'm going to have you do that by yourself with each leg. Good. Then moving forward, I'm going to assess the hips, so I'll have you stand up. And what I want you to do is kind of bend for me. Good. And then I want you to bend side to side. Good. And then I'm going to have you bend down and touch your toes if you can, and then just looking at the spine for curvature, any scoliosis or anything like that, which I do not see. Throughout the whole assessment, I'm looking at coordination, balance, and all of the muscles working as a whole. To finish my assessment, I would do hand hygiene, and that completes the assessment.